Hi, the next list that we have for this class for level 2 is medical words, terminology. Some are sad, some are truthful, but these things happen in an interpreting situation. You have to know the signs. So the first word is normal, normal. Two U's or H's, one stays still, circle and drop, normal, normal. Abnormal is when you shake your head, abnormal, abnormal, okay? Next one is cancer. Use this as a base in a C, cancer. It's like a C to an S, cancer. Next one is poison. This one we've had a lot of discussion with. I've always grown up signing it with medicine, with skull and crossbone. And it's more clear that way because if it was this, it could be skeleton. I know we had a lot of discussion in the class and I've been researching it. And a lot of people say that skeleton is this going down. So I'm just going to go ahead with what I was raised with, and it's open 8 and an open B, and you're wiggling it, medicine, but this medicine is dangerous, so we're adding this, poison, poison, okay? The next one is abstain, and that one is 2 A's, one behind each other, and the back one wiggles away like a 10, like the number 10, and pull it away. Abstain, stay away from. The next one is abuse. Your hand is facing out this way. It stays still with an S, palm facing to the left. You're going side to side to side, not this way, but this way, like this. Okay? Next one is acne, is bent 5s, and you're just tapping down your cheeks, acne. The next one is Down syndrome. It's a D and an S, and you do the D up here on top, and then the S down here, Down syndrome, Down syndrome. The next one is schizophrenia. That one is 2 open 8s. And you're going up and down, because when you have schizophrenia, your mood goes up and down. Okay, so up and down. The next one is Waardenburger's syndrome or Waardenburger's disease, and it's the hand shapes are a W and an S. Starts here and it goes to the back. Waardenburger's syndrome. Waardenburger's syndrome. One of the effects of Waardenburger's syndrome is deafness. So. The next one is heart attack, and it's an open 8, and you touch your chest where your heart is on the left side, heart, and then with a 1, and you're going to hit your finger. Heart attack, heart attack. The next one is stroke, and a stroke is when there's a clot that goes into your brain and everything shuts down. And it's the sign for it is with a 1 and an open B. You point to your head, and then with an S, you hit underneath your open B. Stroke. Stroke. The next one is Alzheimer's, and again, a lot of different signs for it. Right now, I'm going to go with brain, and then this is improve, so it's brain decline. There's lots of signs that say AL, Alzheimer's, because you're rubbing away your memory, but I tend to try to go with the more ASL, so it's brain decline, okay? The next one is insurance, need to have insurance. Insurance, okay? Bipolar. Oh, sorry. I just realized that I did the wrong one. Sorry. Schizophrenia. Go back up to schizophrenia. Sorry, schizophrenia is with an S, and it starts here and it goes down. Schizophrenia is when, sorry, wow. Schizophrenia is when you hear voices talking to you in your head, you know, and you hear things, is that me, is that somebody else? Schizophrenia is when your mind is divided, schizophrenia, okay? Okay, let's go back down. Bipolar, now that is this, bipolar. Sorry about that. Bipolar. The next one is blood. Two fives, blood, and it's just trickling down your fingers, blood. The next one is exam, and it's two V's to bent V's, and you're just exam. So research, examination, okay? Next one is patient, is P. Just like we did hospital before, hospital is like this, patient. The same place, patient with a P, cross on the arm. Next one is temperature. Two ones, one facing out, one facing down, temperature going up and down. The next one is block or clot, and it's two V's, block. It's blocked, block. The next one is sick. Two open eights, one on your forehead, one on your stomach, sick, sick. The next one is inspiration. It's flat O's to fives, flat O's facing towards you, and then the two fives go up. Inspiration, inspire. The next one is seizure, open V and a bent V. The bent V is facing up, and it's wiggling back and forth. Seizure, seizure. Blackout or faint. Again, a lot of different signs for that, but I'm gonna stick with when you faint, you're blacking out brain, and then imagine these as your legs. You're flat on your back. Faint. Next one is allergies. This is the sign for opposite. Two ones. This is the sign for opposite. You're going to start allergies with pointing at your nose and then doing opposite. Allergies. Allergies. Next one is prescription. We did that with poison. We started explaining that. So poison is this with this. Poison. Prescription prescription is this, and you're showing the shape of a rectangle just like they would give you to get a prescription filled. So it's medicine paper like that, square paper. So prescription. Tunnel vision is like this. Or you can, sometimes people do this, tunnel vision, do that extra little step. The next one is shock. You're frozen, you can't say anything, you don't know what to say. Brain freeze. Shock. Shock. Some people say shock, like their jaws just dropped. Like that, shock. That's a different, I guess it's more of a mental, like I can't believe it, whereas this is, this is more medical. Not that you just got news that you found out you were pregnant, but more likely like you just witnessed a bad event. Okay. The next one is scan, and you can either fingerspell it, scan, or bent B and a U, and the scan. You're going your legs. Imagine these are your legs, and you're going in for a scan. MRI, CAT scan, that sort of thing. Pneumonia is with two P's. Pneumonia, all in your lungs. That's where pneumonia happens, as well as bronchitis with two B's, bronchitis. Pneumonia and bronchitis. The next one is diarrhea, and that's it's kind of a O and then a 5, and the thumb goes in, and unfortunately it's just coming out. I know it's gross, but it's just coming out. So that's a sign for diarrhea. The next one is diabetic. I was raised signing it diabetic like this. But many of the books that I've been looking at and the internet say sweet D, diabetic. I've never seen that before, but but we'll see. Not we'll see. There's different locational signs, so I'm just going to follow what it says on the internet because that's what you guys will be looking at a lot of the times to research things. So diabetic. The next one is autism. Autism is 2 open B's, and it is starts here, and then it goes down to your chest. Autism. The next one is ADD and ADHD, and the next one down is birth control. It's all finger spelled ADD, ADHD, and birth control is abbreviated birth control. The next one is transfusion, and towards the inside of your elbow with a 4, transfusion. You're just bringing that towards your elbow, transfusion. Heal is bent 5s to S's, heal. Overnight is, it's hard to do this sitting down. Overnight is like overnight. Overnight. Okay, the next one is stay. Sometimes you have to stay in the hospital, so stay, 2 Y's, stay. An overnight stay, a 2-week stay. Okay, permanent is 2 A's, and you can touch. You don't have to touch next to permanent. And the last one, unfortunately, is terminal, and that means they have the prognosis that they will be dying soon. There's no healing for that. Terminal is soon or soon dead. Unfortunately, it's pretty blunt. So soon dead. Soon, 2 H's going back and forth, and then dead, 2 open B's flipping. Soon dead. Terminal. Okay. Thank you, and study.